Osteoarthritis in the hip causes pain in the groin and makes it difficult for you to walk, go up and down stairs, or even bend over to tie your shoelaces. Osteoarthritis of the hip can have many causes. These include previous injuries, avascular necrosis, where part of the bone dies off, or hip dysplasia, which is a congenital disorder. In end-stage hip arthritis, where the cartilage of the hip is all worn off, then generally the treatment is that of a total hip replacement. A modern total hip replacement is done using minimally invasive, muscle-sparing approaches. This allows the patients to walk immediately after surgery and have a quick recovery compared to more traditional methods where muscle has to be cut for the surgeon to access the hip joint. With these modern techniques, a hip replacement surgery can be a comfortable experience and no longer associated with the patient lying in bed for days and days after surgery. If you have hip pain or have been told that you need hip replacement surgery, go see an orthopedic surgeon quickly so that your problem can be assessed and early treatment can be instituted.